I'd like to start with the first question to Rwanda, one of the countries that is furthest in its journey towards hepatitis C elimination. Dr. Rwibasira, Rwanda was recently one of the 8 countries included in the World Health Organization's country pilots for elimination validation, a process that has really showcased Rwanda as a hepatitis C elimination champion. Can you tell us a little bit about Rwanda's journey towards hepatitis C elimination? What advice do you have to other countries just getting started in this process? And what are the upcoming priorities for Rwanda for viral hepatitis?
Yes, thank you so much. Dear colleague, the board from the Hepatitis Fund, it's a pleasure for me being here invited on behalf of the Minister of Health that's supposed to be here today with us. And on behalf of the entire National Hepatitis Program, I'm happy to be sharing the country experience. But before, allow me to recognize one of my friends that we come along from Kigali, and I'll tell why. Dr. Msabe in the room. He's among the champion that we have in the country that started with the hepatitis program like 2014-15. And by that time, we had like 3 to 4 doctors only prescribing the hepatitis medication. And I want to recognize him that this is the second year of him in retirement, but he managed to keep us beside our program. He managed to be on our side, even this long process of elimination. And he made this long distance from Kigali to Geneva to really keep this strong partnership and to see what he started keep growing and to be advocating even for more to come. Thank you, Doctor. So I'll just speak about 3 main points or 4 to highlight our country experience. But of course, you really understand that the cost to sustain the gain also remains high, and that's why we are here to speak on behalf of the country that managed to do some extra mile, but also to say that we are not really at the end, but we need even more to sustain the gain and to be in the line of maintaining the cost of living as people shared. So it doesn't really make a sense about the fact that we have. I was thinking the liver being the biggest large solid organ in the body, and we are only taking that it doesn't really have a priority now. We are late. We are late. Everyone has a liver. Someone spoke about that. And this is a priority for us to speak more about maintaining the health. So one point that I want to share from other countries, probably from my fellow African country, we had a very good, strong political leadership that so that not the cost of not acting was really high, and Rwanda recognized this before, and we took advantage from the good political willing to advocate for hepatitis elimination campaign. And I would recognize her First Lady, Her Excellency Janet Kagame, the First Lady for Rwanda Republic, that was the champion to hepatitis elimination by that time. And we started by formulating policies and also a national plan for elimination. And through that leadership, we managed to insert the hepatitis elimination through the national district target, that a translation from strategy to implementation into district, what we usually call traditionally Mihigo. And each district had to screen a good number of population. So we had population above 15 and above. So by that time, we estimated around 7 million to be screened. And we managed to complete this target by 2021, whereby 7 million and 300,000 people were screened, and 60 people were, 1,000 people were put on treatment for hepatitis C. So I'll again highlight the second point, beside the leadership, the use of data. So we relied much on the data that we had in preliminary screening campaign about the most risk people. People living with HIV, prisoners, but also people with aged 45 and above, and also survivors of the genocide against Tutsi that were at most people with higher prevalence. So from that side, we build a case to really convince the government this could be the strong, we are probably missing the silent pandemic, as they said, and let's go to elimination that is possible. The number three, it's about relying on existing infrastructures. Our health system are in the sort of decentralized, and around 85% of the healthcare services are provided at lower primary healthcare at health centers. So we leverage on that infrastructure always existing, but also on the investment made toward HIV epidemic control. And then we came up with, let's use the existing healthcare providers, let's use the existing infrastructure and health system that is in place to really manage, screen, make a campaign, of course, engaging partners, medias, and I will thank Chai on behalf of partners that stood with the government through this campaign. And of course, we came up to see this could probably possible to eliminate, to screen, but also to treat. But of course, we had a good partnership, and I will thank our partners here in the room that we managed to have a price negotiated for commodities, whether for testing, but also for treatment that help us to have commodity in country and to people in need. So I will probably say this could be the major key drivers or enablers that help us. But also, as you asked, Doriel, for what could be by now the country priorities, we do share this with other countries as well. Of course, this is the bigger investment and implementation to hepatitis C, but we still need to do a lot in terms of hepatitis B. As they said, we still need to set a generation free for hepatitis B. That is to say, we do more need the birth dose to be introduced to our country. We acknowledge the commitment from Gavi, but we still need more to do, not only to target vaccination, but also to the whole life birth, around 308,000 births per year that we usually have. So we are still advocating for that. We acknowledge the catalytic fund from Global Fund and Hepatitis Fund that is to support the targeted testing through ENC and even vaccinations to birth, but still we need to really have this at a larger scale. And of course, the last priority that probably I will get opportunity to talk about more, it's about integrating the services. So we managed to be having a campaign for screening and treatment, but we need more to integration. So we are looking for countries that like Egypt, that I will highlight that Egypt was our peer model to this elimination campaign. And I would just say that the first batch cohort of physicians was trained in Egypt in 2015-16. So thanks to Egypt, and this is a good learning, thought opportunity that we can recommend other countries. So let me pause by here, and I'll probably need to add more. Thank you.
Yeah. Thank you. Thank you so much, Dr. Rwibasira. Just wonderful to hear, the step-by-step journey that Rwanda has taken towards hepatitis C elimination and now looking forward to elimination of vertical transmission of hepatitis B and hepatitis B more broadly. I think the things that stood out for me in Rwanda's story are, the need for strong political leadership, decentralization of services all the way down to the primary healthcare level, leveraging existing infrastructure, leveraging some catalytic funding, and really good pricing. The pricing set by Rwanda, $60 per patient treated, not only made the idea of elimination affordable for Rwanda, but really has set a benchmark for other countries to aim for.